Dr. Lebowitz, Long Island GYNECOMASTIA Center. So I got this young man. He's for surgery in actually 2 days. 7:30 in the morning on Tuesday. Today's Sunday. I'm here 24/7. I'm here on Sunday seeing patients. So what happened with this young man? His surgery's Tuesday at 7:30. So I always call my patients up the weekend before the surgery, which was yesterday. And he said, "Oh shoot, my mom didn't get didn't open up the packet, didn't get the prescriptions filled, so he didn't have any of the pre-op medications." And he says, he said yesterday, "Oh, can you call him into the pharmacy?" And I remember today was Sunday, and I'm here every day anyway, and they live locally. They're not from, like, Europe or from California. So I said, "Darn it, just come here on Sunday. Let me look at you again," because I did his initial consultation in June, and then he can go right next door, get the prescriptions, and everything's perfect. So I said, why not? I got Mike here. Say hi, Mike.
Hi.
Hi. And we're going to do a little video of the pre-op, and then in a couple days you're going to see the video. So he's a young man. He is 20. How old are you? 20, and he's local, and he's got a good body. He's got good muscle. Make a muscle. Make a muscle. There you go. So he's got these little puff ditties there, and he's in good shape. Sure, he can cut down a little bit of body fat and shred yourself a little bit. But people ask me. Let me start off. People say, "Oh, doc, do I have gynecomastia?" And I always say, if you ask, you got it. Right, I mean, no shit, Sherlock. I mean, otherwise you wouldn't be asking if you've got gynecomastia. So if you wear a tight t-shirt and you got puffy nipples and you don't like the t-shirt and you don't like wearing this, and you have it. Come on, don't ask me, do I have it? If you're asking, you have it. Otherwise you wouldn't be asking. So the next step is it fat or is it gland? Now he's good. Now make a muscle, do an Arnold. So this is all muscle. I mean, this is all muscle. And he's got these little puff ditties there, and you grab them, and they're nice sized glands. Residual from puberty. You didn't take any stuff, any hormones, any testosterone, any tren, any test, or any of that. They're left over from when you were 12 or 13. They just didn't go away. And why people are getting them and why gynecomastia is a thing, I don't know. It's genetic, it's environmental, it's, male testosterone levels are literally half of what they were 10 years ago. So a normal testosterone level, it's a wide range, but normally, it's 700, 800. Nowadays, it's 500 and 400. It's just the way it is because of the PBAs in bottles, because of the chicken we eat, because of the GMOs and stuff, and all kinds of stuff. It's a thing, gynecomastia. Selfies, people are wanting bodies and stuff of that nature. So, enough of talking like this. We're gonna numb him up in a couple of days where the water meets the beach and get these little glands out, at which time he'll go to the gym, he'll build muscle. I mean, he's got great muscle. I mean, look at that. That is great. Shred a little bit more, get a six-pack.
Yeah, of course.
Of course. And really feel good about themselves. It's important to feel good, and don't feel bad about yourself, because life's too short. You got to feel good, and you got to be happy, right? Got to show off your body, and
look at those guns.
What's that?
Look at those guns.
Look at these guns. Let me see.
All right, want to compare it? All right.
Yeah, you're all right. Whose guns are bigger? Whose guns are bigger? You comment. So, anyway, local anesthesia, perfect results. No drains. I don't think I'm going to need drains. Do my internal stitching in there. Back to the gym in 2 weeks. I normally see people 24 and 48 hours later. So he's here because his mom didn't open up the package. He's going to get the prescriptions, and I'm going to see him in 48 hours for the surgery. So you've got gynecomastia. You call me, Dr. Lebowitz, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Oh, and I don't know if I finished. Is it fat? Is it gland? He's all gland. He's got a great pectoralis major muscle there. That's all pure muscle. He does not need liposuction whatsoever. Gland removal, local anesthesia, perfection. Lebowitz. Thank you.